Welcome to our interprofessional research presentation video by Caleb McDonald, Kayla Nash, Stephanie Coote, Vicki Hilliard, and Caitlin Johnson. The name of our article was Communication, Respect and Leadership, Interprofessional Collaboration in Hospitals of Rural Ontario. The authors were Diane Morris, who has a Master's in Science of Food Nutrition, is a registered dietitian, and a Canadian diabetes educator. She also works at Thames Valley Family Health Team in London, Ontario. It's also authored by June Matthews, PhD, registered dietitian, professional human ecologist, and Division of Food and Nutritional Sciences at Brescia University College in London, Ontario. The article is from the Canadian Journal of Dietetic Practice and Research, Volume 75, issue number 4, 2014.
This cross-sectional study consisted of 2 registered dietitians, 1 occupational therapist, 2 physiotherapists, 1 community care access center, a case manager, 1 food service supervisor, and 4 registered nurses. And all of them had about 20 to 35 years of experience. All of these worked in small hospitals with fewer than 408 inpatients a year and in communities that were less than 30,000 people and at least 30 minutes away from places that were 30,000 or more people. So for these studies, the registered dietitians were made team leaders of the 2 interprofessional teams, and the workers were split off into 2 separate groups for this test. So the 2 groups had separate focuses. The first one focused on decreasing the aspiration pneumonia among patients, whereas the second team focused more on working with the Community Access Care Center in discharge planning committee to help patients transition into the community. So each team was from different hospitals within the rural area, and they interviewed people for 30 to 45 minutes there, and their interviews were recorded on audio tape and then transcribed verbatim, and they were then used to create a questionnaire, which was later used, and everyone that was interviewed was given a $30 gift certificate for their time and hard work. So for this thing, descriptive qualitative research occurred throughout the data collection procedure. During first level analysis, they sorted the data into Excel worksheets. In mid-level analysis, the conceptual models were created to capture the unique relationships between the themes. And the registered dietitians then met at the end to discuss the emerging themes that they saw and to reach a consensus. The study was then approved by the Research Ethics Board at Brescia University College, the Health Sciences Research Ethics Board at Western University, and the Hospital's Ethics Board.
Okay, the results of the article include: members of Team 1 perceived their team in terms of a medical model of care. One of the participants includes the whole healthcare system is built under a medical umbrella and the doctors are dominant. Members of Team 2 saw their team as a medical wheel. Each healthcare profession represents a spoke. All members worked collaboratively as a team. There are 3 common themes within this article. Themes included communication, respect, leadership. Each team came up with benefits and challenges they had overcome within the team dynamics. Each team commented that interprofessional teamwork provides insight to professional growth and improved patient care within the community. There are more similarities than differences between the 2 communities. Benefits included a personalized work environment, long-term relationships, goal settings, being familiar with patients and their needs. Some of the challenges included working part-time, confidentiality, and tension between patient flow and accommodating the patient's needs. In this article, authors discussed what an ideal interprofessional team is. This is when the patient and the family are a central team. Team functions through multiple linkages and among a number of healthcare professionals in the process of interprofessional collaboration.
Okay, in conclusion,
Many of the participants had little formal training working interprofessionally. However, the established professionals functioned well together. The study was quite narrow, leaving more to be learned. It is suggested that interprofessional practice be taught in school early on to help those entering the workforce, as they will benefit from a solid foundation of experience to move forward with. We identified many weaknesses in this study, the first of which was how narrow of a spectrum the study had, and it also lacked participants and was only done over a small geographical area. There was also a big lack of diversity in the participants, as they were all middle-aged females with at least 20 years experience.
So the following is recommendations as to how dental hygiene can be placed into the research. So the research can be applied to dental hygiene, as this profession is also vital in the oral and overall health of clients. Rural hospitals have many clients who are awaiting long-term care facilities, so they are there for an extended period of time, and some of them enter the hospital for palliative care. Therefore, this proves that it is important for schools to incorporate interprofessional practice into curriculum in order to provide new professionals with the tools necessary to productively work interprofessionally without having to gain the experience over a long period of time. For our new research proposal, the purpose is to expand into more rural hospitals in order to gain further insight into patients with unmet oral health needs by introducing dental hygiene to the atmosphere. For our methods, we will find participants for the study, and they're going to be from 5 rural hospitals. The professionals will include registered nurses, registered practical nurses, dental hygienists, PSWs, and dietitians. The professionals will range from 1 year experience to 35 years experience, and they will be male or female. Communities with a population of about 50,000 residents will also be included in the study, and the study will be a length of 6 months. A pre and post test will occur for oral hygiene assessment. A pre-survey and post-survey will also occur, and it'll be to survey all the professionals about interprofessional practice. The dental hygienists are going to develop a visual oral health assessment forms for the RNs and RPNs. Dental hygienists are to demonstrate visual oral health assessment. The dental hygienists are to train the RPNs for oral hygiene, and the RPNs will perform oral hygiene on clients. This includes brushing and flossing. The RNs will collect the data from rural hospitals, and the registered dietitians will develop individualized meal plans in collaboration with RNs and dental hygienists. The RNs, DHs, and RPNs and dietitians will collaborate on the findings of both the oral health assessment and on these surveys for the pre and post survey about interprofessional practice. In the post surveys to determine if collaboration with dental hygienists improves the oral health of the patients throughout the reassessment.